Hi everyone. Today there's been a request to go over chronic viral infections and how that leads to chronic health problems by people that are following us on YouTube. And if you have suggestions for any of our future talks, just let us know, and don't forget to follow our page. Anyways, when you look at viruses, there are some viruses that can become chronic, and this can lead to chronic fatigue issues, and it can lead to general loss of function, and it may take a while to get diagnosed. But let's go over some concepts with viruses, maybe for the first 15 to 20 minutes, and then what I can do is I can then go into some lifestyle applications and various nutraceuticals that can be helpful if you're dealing with a viral response and so forth, and go from there. Now, when you look at viruses, there's basically 4 different classifications of how a virus will impact a person, whether it's acute, chronic, latent, or progressive. So let's give the examples of each one first before we get into this. So there's some viruses that are acute, like influenza, rhinovirus, the common cold, the flu, even SARS-CoV-2 are all acute viruses. You get the infection, you have symptoms for a while, your body learns how to deal with it from an immunological perspective, and then it's resolved. And then it's unlikely to deal with the virus again unless the virus mutates, and then as the virus mutates, you're susceptible for the infection again, and then you get another acute response, which is basically what happens with rhinovirus, the common cold, or influenza, like the flu, where it just mutates, and then we have this, let's say flu season, and then we get this infection, and it's acute. So some viruses only have an acute effect. And then there's a certain group of viruses that are classified as viruses that have latent effects. And what this means, these are viruses that you get the infection, you get the viral infection, you have symptoms, and then the symptoms go away, the virus becomes dormant, and then it gets reactivated. And the most common examples of that are, for example, herpes viruses and Epstein-Barr viruses. You get the infection, and you may have acute symptoms for a while, and then the immune system can kind of decrease the activity of the virus, so the virus is not dormant, and then it's in remission, and then it gets reactivated. So those are latent viruses, and they're different than acute viruses. And then there are some viruses that are chronic, and chronic viruses are things like hepatitis C, being the most common chronic virus. And this is a virus that constantly has some degree of activity and continues to cause immune challenges for the lifespan of the person. And then you have what are called progressive viruses, and progressive viruses just tax the person and cause devastating effects. And the most common persistent virus is HIV. So when you look at viruses, not all viruses are the same. We don't have the same effect with all viruses. It really depends on the strength of the virus, how smart the virus is, and how it deals with our immune system, and if our immune system can use its defense mechanisms to keep it under control. So again, the main categories of viruses are acute, latent, chronic, and progressive. So I like to touch upon a few of these things and really talk to how they relate to chronic diseases and how they impact people's health, and what we see in a functional medicine approach to chronic viruses, and if you're dealing with chronic fatigue issues or chronic immune challenges, what kind of things you should be looking at. Now, I think for the most part, what we're really realizing, especially with this pandemic and this COVID-19 period, is that viruses impact people differently. And we've always knew that when there's flu season, they're susceptible people, elderly people that had chronic diseases. If they get the viral infection, they can have complications. It can promote death. And we're seeing the same thing with this pandemic. And I think it really stresses the point of just having overall health and overall immunity is a key thing to constantly help us deal with viruses. So if a person's a chronic smoker, if a person has diabetes, if a person just has chronic lack of sleep and drug abuse, alcohol abuse, they're going to be more vulnerable to the adverse effects and progressive destructive effects of a virus than someone who's, let's say, somewhat healthy as a general concept. Now, when you look at viruses, the interesting thing about viruses, and a lot of understanding of how viruses work, chronic viruses work, is when you look at hepatitis C. So hepatitis C is one of the most common viruses and the most common chronic virus worldwide. And about 40% of people that have hepatitis C initially present with no symptoms. They just go in and get a routine lab test, and they just show they have the hepatitis C virus. And the other 60% have some degree of symptoms. Some patients, for example, may get fatigue, they get swollen lymph nodes, they basically get flu-like symptoms and body aches and body pains when they have hepatitis C. They may even get pain right over the liver when they have hepatitis C. And then those periods may improve, not improve. They may constantly stay that way, or they may get worse. So one of the interesting things about hepatitis C is when people get it, they can do a hepatitis C genotype test, meaning that they'll test a person and see what kind of genes they have associated with the viral response, and they can predict how some people may have worse prognosis with hepatitis C. So the virus itself has a different effect on different gene types, and this is true of all viruses. So with hepatitis C, in a clinical diagnostic setting, you can actually measure hepatitis C genotypes, meaning the genes of a person, and seeing if they are at more risk for having severe adverse effects and they get hepatitis C infection. So it's not just the virus, it's the virus plus the host, and it's not just the health of the host, but it's also the host's genes that all really play an impact into how they respond to a virus. So when people actually then get a viral infection, let's talk about testing really quickly. There's basically two types of testing for viruses. The first type is an antibody test. In an antibody test, they have different types of antibodies. The two main ones that are being used for viral testing is one called IgG antibodies or IgM antibodies. IgG antibodies mean you have previous exposure. IgM antibodies means you have an acute infection. So initially, when you get a viral infection and your immune system starts to respond with what's called humoral responses or antibodies, it produces antibodies, and the first form of antibodies it produces is IgM. Now, there's a period of time between a viral infection coming in and the development of IgM antibodies where you can get a false negative test with the antibody test, and this is where they do what's called a PCR test, a polymerase chain reaction test, a reverse transcriptase test. And this is a term that they use to look at viral replication and how active the virus is. So right now with the pandemic, people that are getting nasal swabs and being checked to see if they have coronavirus are getting a test, and they're doing a PCR test, which determines if they have an active infection. And to determine if someone has immunity, they would then do an IgG antibody test to determine if they've made antibodies so they can protect them against the virus. So those are the different types of testing. Now, there's a lot of dysfunction and error in the healthcare system when it comes to viruses, especially in the preventive medicine, alternative medicine world. For example, someone will go see a functional medicine doctor and they'll test them for viruses like Epstein-Barr is a common one, and they'll show they have IgG antibodies, or they'll check them for cytomegalovirus or a whole list of viruses, and they show all these IgG antibodies out of range. And the patient then, and even the healthcare practitioner, assume that they may have these viral infections, and that's really not the case. So just so you know, over 90% of the U.S. population has IgG antibodies to Epstein-Barr. Which means we've had exposure. It hasn't really, we have some immunity developed against it. It doesn't necessarily mean we have an active infection. So you got to be very careful looking at lab tests. If you're a chronic patient and you've had your stack of lab tests from seeing lots of practitioners, if you ever see a practitioner diagnose you with a chronic viral issue because of an IgG test, you are really working with someone who has no idea what they're doing. And this may seem pretty rare, but it happens all the time. Like as a healthcare professional, your patients come in, you see stacks of labs and what other doctors have done to try to help them, and you see time after time practitioners running antibody testing, seeing IgG, and then assuming that that's an infection, and they put the patient on all these supplements for a viral infection forever, and it really has nothing to do with it. So that's one of the first things I think is really important for everyone to understand is IgG antibody to a virus, immunoglobulin G antibody to a virus is a commonly done test, but it doesn't mean you have an active infection. And the gold standard way to determine if you actually have an active infection is what they call the PCR test or the viral load test. And that's what they're using right now for coronavirus. and that is a very specific test. But it doesn't mean that you have immunity, and the immunity test is a IgM. So IgG. So let me just rephrase. PCR test means active infection. Gold standard means the virus is replicating, it's in the system. IgM is an antibody that goes up right in the acute stages of a viral infection. And then IgG antibodies to a virus are there to determine that there's a chronic infection. So that's the basic concept of testing. Now, when you look at how viruses work, viruses are very advanced pathogens. And the key thing with these viruses, especially the ones that become chronic and persistent and progressive, is that they can outsmart the immune system. And then the viruses that become acute, that things like influenza or rhinovirus, that we can usually deal with recover within a week or two, are less advanced in their ability to outsmart the immune system. So typically, let me just kind of give you some immunology background to understand these concepts. If a pathogen comes into the body, let's say a bacteria, for example, if it comes into our system, into our body, breaks our mucous membranes, breaks one of our barrier systems, we have immune cells throughout our body that immediately identify them and create an immune response. And they even start to eat them up. These are called macrophages. And then these macrophages call two types of cells to come in to help them to deal with the pathogen. One of these cells are T cells and natural killer cells. They're all part of the T cell family, and they're there to be more aggressive and more destructive against the attack. The problem with these T cells are they can't really, let's say, find these pathogens very well. Just think of them as like elite SWAT team soldiers that are there to deal with the pathogen, but they can't see where they are very well. And this is where the immune system makes B cells, are called antibodies, and antibodies are proteins that then attach to the antigen, and then these T cells can really pick out where they are immediately and then go in and destroy them. So in order for us to really deal with the pathogen comes in, we have to get our natural killer cells and T cells up to destroy them, but our cells that destroy these cells aren't very efficient finding them. This is why we have to make antibodies called by B cells. And B cells make these antibodies, they attach to the pathogen, and then T cells can immediately find them and immediately destroy them. Now, what makes viruses a little bit unique is, let's say compared to bacteria, is when viruses come in, first of all, they can see these macrophage cells, which are kind of the surveillance cells of the immune system that start the whole thing, and they just go past them. And then these viruses can actually get into the cell, and once they get into the cell and attach, then they'll go into a process where it's called viral replication. So once they go through attachment, they'll go through viral replication, and they'll start to reproduce viruses. Now, different viruses attach to different tissues. So hepatitis C binds to hepatocytes, liver cells. The polio virus attaches to myelin and neurological target proteins. So SARS-CoV-2 is finding to attach to different proteins or ACE2 inhibitors, ACE inhibitor enzymes throughout the body. So different viruses attach to different proteins that can cause the expression of those tissues in those areas. Some are systemic, some are localized to one area. And then once the virus gets into that tissue, it'll start to replicate. And then it just replicates more and more viruses. And then finally the cell gets built up with these viruses and explodes, and then all these viruses continue to grow. And what makes the virus chronic is their ability to hide from the immune system, get into a cell, replicate, explode out of the cell, burst out. And now you have all these viruses that are spreading, and then they go into cells and do the same thing. So our defense against a virus from doing that is a process by immune cells, and not to get too technical here, but there's a process by immune cells called MCHC proteins, which is basically a signaling agent. So in a healthy immune system, when a virus comes into the cell and infects it and starts to replicate, there's a messenger system from the cell that puts these proteins on the cell surface of the infected cell and tells the immune system, hey, I'm infected, and there's viruses replicating inside me, so come destroy me. And if that MCHC protein, little protein signals on outside of the cell surface, then our circulating T cells come in and destroy it. If that happens, then the virus can't continue to spread. So as long as we have these MCHC proteins that lets the immune system know that there's a virus inside the cell replicating, and we have antibodies that can immediately attach to the virus, then the virus can stay as an acute virus, right? Like influenza. It comes into the body, we make these antibodies against it, we make these cell surface proteins to identify where they are, and the immune system comes in and destroys it. It's the same thing right now with SARS-CoV-2, coronavirus. It's an acute virus. Our immune system can identify the viral infection inside cells by these proteins, and it can make antibodies, so it doesn't become a ongoing chronic persistent virus like hepatitis C. Now, there's other viruses that come into the cell, they replicate, and then they pass out. These are the latent viruses, and then they become reactivated or not activated based on how much stress a person has to their immune system and to their health. So, for example, people that have, let's say, herpes virus, maybe they have the oral herpes type, where they get the skin reactions around their lips and so forth. They usually get it when they're tired, they're exhausted, they've been under a lot of stress, or they've overused alcohol or something. Then they'll see the expression of their herpes virus come out. And then when they're healthy and getting sleep, it becomes dormant again. And same thing with Epstein-Barr. Some people get Epstein-Barr viral infections. They go through a series, inflammatory acute state for a while. They recover, and then anytime they really push themselves, they can have their Epstein-Barr virus reactivate and then put them down again. And then with hepatitis C, some people have chronic progression over a period of time and constantly have symptoms. Some feel better, some feel worse. So there's different expressions of these different types of viruses. Now, when you're looking at the big picture, is, and how this applies to chronic healthcare is, lots of people end up with some of these latent viruses like hepatitis C, latent viruses like Epstein-Barr virus, where they're, and the most common one being Epstein-Barr virus, that when they get fatigued and run out, then it starts to express itself. And then there are those people that have certain things happen to them when they get a viral infection. So let me go into this. So why are some people having complications with COVID-2? It's an acute virus, so why are some people getting seriously ill? Why are some people dying with it? Why are some people never the same, whether it's an acute infection, acute viral infection or not? Well, there's lots of things that can happen when you get a viral infection. And one of the key things that can happen when you get a viral infection is you can develop inflammatory reactions and even autoimmune reactions in other tissues. So there's four main mechanisms, and let me go over these really quickly with you. One of them is called molecular mimicry. So if you get a viral infection, let's say you get Epstein-Barr virus. Epstein-Barr virus will come in, create an immune response, and antibodies will eventually be made against the Epstein-Barr virus. But what's been found is that some of these antibodies produced against a virus can also bind to human tissue protein, because the structure of the virus has an amino acid sequence that is so similar to some tissue in our own body that the antibodies made against the virus can also attach to those tissues. So Epstein-Barr virus has been shown to cross-react with the thyroid gland, causing Hashimoto's. Hepatitis C virus has been shown to cross-react. So it can then cause some thyroid inflammation or some thyroid destruction. So this is the concept of molecular mimicry. It's where you have antibodies made against the virus that can bind to other tissues. Hepatitis C has been found to create the cross-reactivity with myelin. Now, what we understand about molecular mimicry is that if the protein structure of the virus is similar to a protein structure of our own tissue, then antibodies made against the virus can also bind to our own tissue and then cause some destructive responses, or turn on or aggravate an autoimmune disease. Now, the key thing is that it's not just the antibody alone that causes this. That's why everyone who gets, for example, hepatitis C or Epstein-Barr doesn't end up with an autoimmune disease, but there's other immune factors, and one of them is called immune tolerance, and this is how your immune system can dictate self from non-self. And it's a complex series of pathways which involve other cells called regulatory T cells and B cells and regulatory B cells that modulate whether you actually have this molecular mimicry mechanism take place. But it is possible for some antibodies to cross-react with other tissues. And this is also a concern when they do vaccine safety studies, because some vaccines can be produced that turn on antibodies, but these antibodies then cross-react with self-tissue proteins in the body and then cause adverse reactions and autoimmunity. So one of the ways that viral infection can cause some serious problems is through this molecular mimicry mechanism. Now, Dr. Vijjani and I are doing a study. We published the initial findings of our studies with SARS-CoV-2, spike proteins and nuclear proteins with self-tissue proteins in the journal Clinical Immunology, and we found that, for example, some people that may get this current form of coronavirus, the COVID-19 exposure or infection, may have cross-reactivity with target proteins like the thyroid and neurological tissues, and even some blood-brain barrier proteins, and so that's a risk, and that's a concern for us for vaccination and so forth. We're finishing up the study, but we published our early findings of that. So that's the concept of molecular mimicry. There's another concept how viral infection can cause serious problems for susceptible people, and not everyone, but it's called epitope spreading. And this is where a virus will come in and destroy tissue, and then when the tissue is destroyed, proteins from the tissue are released in the bloodstream, and then the body makes antibodies against those other proteins as well. So you can have, let's say, a virus that comes in and, let's say, attacks the thyroid, causes thyroiditis, and then you get release of thyroglobulin in the bloodstream, and then the thyroglobulin released in the bloodstream is reacted against as if it's a foreign substance because the protein structure changes a bit, and now you have antibodies against thyroglobulin. Now you have the development of an autoimmune disease, not from molecular mimicry, but what is called epitope spreading. And then there's also other concepts called bystander activation and cryptic antigen exposures, where viruses come in and cause tissue destruction, but I think getting too technical. But the key concept is this. When you get a viral infection, some of these viral infections come in and they can trigger these other immune responses that can lead to a series of problems from those mechanisms. And those could be acute viruses. So then the question that I just wanted to leave with here before, some other concept before I'm just rambling.
Yeah.
Viruses there's so much information in viruses. I'm so sorry. I don't know how to make it simple. And I'm just struggling to try to figure a way to simplify these concepts. But let's just say, what do you do? Well, if you do have a viral issue, whether it's chronic or acute, there's a few lifestyle things that are really critically important. And I made, right when the pandemic started to become a serious problem, we made a series of videos on how to improve your immune resilience with lifestyle factors. And if you go to Dr. K News, it's the Immune Resilience Program, and you can just download it for free. It's a free program, and it just goes into basic concepts of what you need to keep your immune system healthy. But the basic concepts and most important thing is you need to have sleep. Natural killer cells, which are there to fight viral expressions, required to have mechanisms that are triggered when you're asleep. So when you're asleep, your melatonin levels go up, your cortisol levels go down. There's changes in immune activity to your immune different cell messenger proteins and that activate your immune system, and it keeps your immune system healthy and functional. Even one night's sleep can impact your response to a viral infection or to a chronic virus that you may have. So sleep is really critical. Getting proper rest, but at the same time getting movement and motion is critical to get your lymphatic system going. But those are the main ones. Some exercise to the point it doesn't fatigue you, some movement to the point you can handle it without overtraining, and making sure you get plenty of sleep is the only way to really get your immune system healthy enough to deal with a viral response, and that's critical. Hydration is really important as well. And then people always ask about supplements, so let me just give you the most important supplements. Echinacea has the most literature published as far as impacting viral responses, and several large meta-analyses done with echinacea and viral responses. So if you're looking at what has the greatest amount of evidence to help support a viral infection, it's kind of boring, but it's echinacea. And echinacea is cheap, and echinacea is very effective. It's just not trendy. It's not popular anymore. It's not the new cool thing. People are doing all these different colloidal silvers and all these other things, but echinacea has a tremendous amount of evidence that should not be ignored. Astragalus is another botanical that's been shown to really support natural killer cells. That's very effective. Vitamin C It consistently shows that it helps support immune cells and natural killer cells function more efficiently, and that's important. And then the other parts of it is when people do get a virus, sometimes they get lots of aches and pains and they don't function well. And you can support in the antioxidant, anti-inflammatory system and B cells as well to kind of reduce some of those effects. And things like green tea extract or grapeseed extract can be very effective in supporting that. So echinacea, astragalus, vitamin C, grapeseed, and green tea extract are all very effective ways to just have general support. Now, I don't have a protocol for you for coronavirus. There is no protocol for coronavirus. There's barely being research done to figure out how to manage it and how to treat it, and it's just too early. So the concepts I'm telling you are just general concepts to support your immune system. I don't have a protocol for any specific virus. We don't do that in a functional medicine approach. We just try to make the immune system healthier. So with all that babbling and confusion and my inability or attempt to try to take these concepts and make it simple, let me take questions, which may be the best thing to do.
Okay. Okay, I just have a couple things to...
My wonderful wife, Dr. Andrea Reyes, is here helping me.
I'm going to try.
She's already telling me how bad it is.
Not bad.
But anyways, I'm trying.
It's going to be great. It's going to be awesome. Okay, so let me say a couple things that I've noticed. Can you speak to someone who has autoimmunity and they might want to take ashwagandha or echinacea or things like that?
Right. So if you have an autoimmune disease, it doesn't really matter which one, but if you have an autoimmune disease, one thing that's clear is that the immune system is overactive, that it's not regulating itself pretty properly. That's the pathophysiology of an autoimmune disease. And there's two parts to the immune system. There's the T cell response and the B cell response. And the T cell response has been generalized to what they call the Th1 response, and the B cell response has been something they call a Th2 response, and that's like a general mechanism. And then there's like Th3, Th17, Th9, there's a lot of different Th pathways, but the main ones are Th1 and Th2. And then they found certain nutraceuticals impact Th1, certain nutraceuticals impact Th2, and for some people that have autoimmunity, they just can't tolerate it, one or the other. And some people have no problem tolerating it. So it's a set of unique variables. Now, there isn't a lab test we can do to clearly tell if they will respond adversely to an immune-enhancing supplement. Some people, you measure their labs and look at what are called Th1 cytokines. They're off the chart, and you give them Th1 supplements, and it actually calms down their autoimmunity. And then another group of people that have the same Th1 activity over dominance in the immune system, you give them Th1 supplements and it makes them flare up and makes them get worse. So unfortunately, whether we measure their Th1 or Th2 dominance with different laboratory tests doesn't necessarily mean that we'll know how they respond to Th1 or Th2 supplements. Some autoimmune disease patients will not do well. They'll just notice their symptoms get worse. So let's say you have rheumatoid arthritis. That's an easy one. You might take echinacea, and all of a sudden your joints hurt like crazy. That it's actually activating your immune system, and you're more inflamed than before. Whereas another person may take echinacea with RA, rheumatoid arthritis, and have no joint pain, and doesn't notice any difference, but they're able to deal with their viral infection and get their white blood cells improved, let's say, if they're having a viral infection. And then other people can take echinacea and actually see their joint pain go down. The key thing is if you are suffering from an autoimmune disease, you really want to just never just go on a huge cocktail of immune-supporting supplements all at once. You may want to start with one and then see how you respond, and then go to the next one, and so forth. The symptoms you would expect to find are based on which autoimmune disease you have. So if it's rheumatoid arthritis, the immune system is attacking your joint, so you'd expect joint inflammatory symptoms. If you have, for example, Hashimoto's, which is the most common autoimmune disease, you may take a supplement and notice that your thyroid is getting more swollen, or you're getting your metabolic rate's going up, and now you can't sleep, and you have anxiety, and you're getting some tissue breakdown from your thyroid hormones getting into your circulation. So those are the things to think about if you have an autoimmune disease. Be careful, go slow, and you're going to have to identify your own unique reaction to them.
Perfect.
Okay.
Back on track. Here we go. Okay. So Genevieve asks, testing or treatment of chronic systemic bacterial infections that use the immune system, such as lupus, for infections. That doesn't make any sense. I'm sorry. I'm off track too. Wow.
Right.
Wow. It's contagious. Disease. It's contagious. Okay. Sorry. Okay. Wendy asks, wouldn't a serology test be more accurate to test antibodies instead of PCR?
Serology just means blood work. So a PCR test, PCR test and antibody tests are all serology tests. PCR test is your gold standard test to see if you have an active infection, but it doesn't tell you if you've developed immunity to it. The antibody test is the only way to really know if you have immunity to it. So that's the difference. So for example, if you think you have, with this pandemic, you have new symptoms and you feel like you may have coronavirus, and you get a testing done and do a nasal swab thing, they're going to be checking for a PCR test to see if you have an active infection, viral replication. But if you think, hey, maybe I had a cold and maybe that was coronavirus, and maybe I'm one of those lucky people that had it but never really had lots of symptoms or had mild symptoms, and now I'm immune to it, have some degree of immunity to it, that's where you would want to check your IgG antibodies to SARS-CoV-2.
Okay. Someone also asked, can you quickly explain the difference again between IgG giraffe and IgM melon?
Yes. So there's different antibodies that take place and different stages of the antibody responses that take place when you have an infection. During an acute infection, the first antibody that goes up is an antibody called IgM, like Mary. Okay, and IgM lets you know that you have an active infection. The problem with IgM is that IgM, there's a lapse of time when you actually have an acute infection, and the IgM levels are not high enough to determine that you're actually positive. So IgM takes a few days to kick in and get to levels where they're identifiable. It can even take a week. So this is why when they're actually looking to see if someone has an active viral infection, they're not using the IgM antibody. It can be used, but they're going to be lots of patients that actually have infections will be missed. So that's why they'll do the PCR test, the reverse transcriptase test, as a way to check for it. Now, once you deal with the infection and your immune system has made antibodies against the pathogen, it'll have what are called memory B cells ready to go to make antibodies as soon as you get re-exposure. And this is where the concept of immunity comes in, is that you have these IgG antibodies. And these plasma exchanges where they take patients that have had, for example, coronavirus, and they give them blood, what they're doing is they're taking patients that have antibodies, IgG antibodies against coronavirus. They're cleaning up the serum, cleaning up the blood, and then giving IVs to them, to people that are infected, to get them to respond. And those outcomes have been pretty good in South Korea and some of the new studies that are being done in New York and some of the universities throughout the country. And that's the concept of an IgG. So IgG is ready to deal with the virus. And what the antibody does is tag the virus protein, so your immune system can easily identify it and start to destroy it. And that's the purpose of the antibodies. So IgM is acute, and IgG is more of an indication of some degree of immunity developed. And when you look at different viruses, and we look at people that get vaccinations, for example, they'll look at their IgG count. And if their IgG count is low for a specific virus, that means they may not have as much immunity to it. So some people will maintain their IgG count for years and years and years, which means they have some degree of memory B cell activity and ability to produce antibodies very, very quickly if a virus comes in, so they may not even have any symptoms at all. And this is what we're trying to learn with, for example, with the coronavirus that we're dealing with, is how long do these IgG antibodies last? And unfortunately, they're finding that they're not lasting long term, that they're going down within a short few months. And also, if the coronavirus mutates, you may not have as much immunity to it from the previous antibody IgMs that you've developed. Okay?
Yeah.
So hopefully that...
I'm not sure if the feed went off.
Oh, I can see stuff here.
Can you see? Can you ask people if they can give you a thumbs up if the feed's still on? I'm sorry. It switched off on my computer.
Oh. So... I think Andrew says that Facebook changed their structure, so we're having some difficulties. But hey,
I have questions. I can't.
Oh.
It's just clicked off on mine. I don't know.
No, that's good.
You're good?
Yeah.
Okay. I'm not gonna stress. Sorry. I'm sorry. It's
Okay.
just a mess. Okay.
So
No.
hopefully that.
Oh no. I'm not sure if the feed went off. Oopsie. Okay.
Go ahead.
Okay. Best test if chronic Epstein-Barr virus is expected. Chronic.
The best test if you have chronic Epstein-Barr virus is expected.
What's the best test for chronic Epstein-Barr? Like not current symptoms, but maybe you've had it in the past and it's now been a long time. But
well, listen. The best test for chronic Epstein-Barr virus. The problem with that is that 90% of the population have Epstein-Barr virus antibodies because they got exposed to it and never even had symptoms or were easily able to deal with it. So you can just measure Epstein-Barr virus IgG, but 9 out of 10 times is 9 out of 10 people are going to have positive responses. The most important thing with Epstein-Barr virus is to see if it actually causes active acute responses, because it's one of those viruses that goes latent and then can reactivate, and so it can go into this dormant state and then reactivate again. So they actually have a panel called an Epstein-Barr viral panel, which will check different markers, for example, like a viral capsid antigen marker or early presenting marker, and they can determine if the Epstein-Barr virus has been reinfected. But if you're checking to see for chronic, this would be an Epstein-Barr virus IgG, means you've had exposure at some point. The most important thing is if you think you've had Epstein-Barr and it's activating again, is to make sure you get Epstein virus panel, and that'll include markers to determine if it's reactivated. Now, the other key thing is just to look at your white blood cells. If you ever had any lab work, look at your white blood cells. White blood cells change when you get an infection, and in the acute stages they go up. And for people that are dealing with a chronic virus, they usually have very low white blood cells. Okay, next question.
Okay. David was asking, in your practice, which viruses and tests do you most often? Like, what do you see most commonly?
So in my practice, I don't necessarily run into doing a lot of viral testing on patients that are chronic, unless I see some indications of that, like a history that explains where they may have got infection and never recovered. Also, a red flag for me is if I look at a patient's complete blood count and I see their white blood cells are abnormal. And typically if I see their white blood cells are low, then I'm suspecting chronic viruses. Or if I see like a marker like monocytes high, then I might suspect they may have an active Epstein-Barr that's been reactivated or something like that. But the most common viruses that impact chronic disease, I would say number one is hepatitis C. It's very common, and for many people it's silent. And even though it's silent, the antibodies produced against hepatitis C can cause cross-reactivity in molecular mimicry. And then with hepatitis C, some patients aren't silent. They actually have chronic fatigue and chronic swollen glands, and their immune system is totally exhausted, and no one's actually identified that as hepatitis C. So that's a very commonly misdiagnosed one. And then as far as latent viruses, the most common one will be Epstein-Barr virus, as far as what people really suffer from clinical symptoms. Now, if you go and test rotavirus, cytomegalovirus, and go through a whole list of antibody checks on a blood test for IgG, a majority of people will have antibodies to them, but it doesn't mean that it's active. So be aware of that.
Okay. Is ELI spot testing worth it to check for current infections? ELISPOT.
Spot testing, I think.
ELISPOT. I don't know what it is.
Yeah, I'm not sure. I can't answer that question. I don't know.
Okay, Luna, what if any specific genes are involved in being susceptible to viruses like Hep C?
Right. So that's the interesting thing is there's genotypes and it relates to viruses. They don't know most of the genotype susceptibilities. The most well understood one has been hepatitis. So with hepatitis C has had some tremendous breakthroughs in healthcare and management. They were able to over time figure out not just the PCR test of how active the virus is, but they can also do something called a hepatosure to get a clue of how much damage is being done to the liver, to see how active the virus destruction is. They've been able to do a genotype test to see what the gene issues with the person, and they can determine treatment, and then they've been able to actually develop treatments for some genotypes to actually cure them of hepatitis C. So it's virus dependent. We don't know what all the different genotypes are with each of these, but it's an ongoing area of investigation. Hopefully, as time goes on and more research gets published, we can see that certain people will have certain susceptibility for, let's say, Epstein-Barr virus to become more aggressive with them than for someone else who doesn't. So that's the key thing. It's your genes plus how healthy you are, plus the virus itself, and the mutated form of virus that can cause the symptoms. That's why people have so many diverse symptoms when they get exposed to the virus, even right now with coronavirus. Some people have no symptoms. Some people have dramatic symptoms. Some people fall apart. Some people are only sick for a week. It's all these different factors that are all coming into place that cause those outcomes.
Okay, people are asking for white blood cell, how low?
So when you look at your total white blood cell count, most labs are going to have a range of somewhere between 3.5 to 5 being a normal reference range, and typically when you see white blood cells below 3.5, you would want to suspect that there's some chronic immune activation going on. Now, a lot of autoimmune disease patients have low white blood cells that don't have chronic viruses. Their immune system is so weak, and once they get into a healthy lifestyle to support their autoimmunity, their white blood cells go back up. But anytime you see white blood cells, they say below the 3.5 range. I'm using U.S. standards. I'm not sure what the numbers are in other countries, but you would, if you see levels below 3.5, you'd want to suspect looking at something causing the immune system to be weakened. Sometimes it is chronic virus. The most common one that people overlook all the time is hepatitis C.
Okay. Yeah.
Yeah.
Christina, what is your preferred test to assess chronic infections? Is there a panel that looks at several? What is your preferred test?
Yeah. Preferred test
to assess chronic infections.
Right.
And is there a panel that looks at several?
Yes, there is a immune panel that Cyrix Laboratory uses that will check and screen for chronic infections, and it'll have a list of I think it's like 20 different viruses, and it's just a screen. So it's a screening test. It's a pathogen panel, Cyrix pathogen immune panel screen, and that can be used to get a general idea. The problem is when you do screens is sometimes you get screens that just show past exposure, so you have to be very careful to do follow-up testing if you see them. So the one I use in my office sometimes when I'm just screening, just to kind of see what exposures they may have had with viruses that especially that can lead to autoimmune disease, is the Cyrix pathogen panels.
Okay. Is there a connection between Epstein-Barr virus and chronic fatigue syndrome?
Yes, there's numerous amounts of studies with Epstein-Barr virus and chronic fatigue syndrome, and any virus that becomes chronic can cause chronic fatigue. It's just that simple. So any progressive virus like HIV, any latent virus that gets reactivated like Epstein-Barr, or any persistent virus like hepatitis B that becomes chronic, or hepatitis C, will cause chronic fatigue. It'll just wipe out the ATP levels for the immune system to deal with it, and the inflammatory response with viruses uncouple what are called mitochondria in the cells, which makes the person less efficient to make their own energy, and it's very typical. It's a thing that always has to be ruled out. Anyone who has chronic fatigue and very low white blood cells, they really should be screened for chronic viruses, especially hepatitis C or a reactivated Epstein-Barr virus.
Okay. This Cassia has a comment. I specialize in Epstein-Barr virus. We recommend 4 antibodies: EBNA IgG,
Yep.
VCA IgG,
Yep.
CVA IgM,
Yep.
EA IgG,
Right.
and Dr. Vijani has EBNA IgM on top of that.
Yeah, that's basically your classical Epstein-Barr viral panel.
Okay. But people are commenting on it, so I just want to make sure that's right.
Mm-hmm.
Yeah?
Mm-hmm. That's great.
Okay. Perfect. So people are asking, how do you confirm Epstein-Barr virus, Hashimoto? Like, how do you confirm these things? Is it just on symptoms with testing?
No, you have to do testing. You can't. There's no way you would know from symptoms if a viral response is happening, because typically the main symptoms of virus response is that a person is just really fatigued and tired. They may or may not even have a fever, depending on the virus type, mm-hmm. and they may have lymph node swelling. They may not have lymph node swelling. However, like if I was working up a person that had chronic fatigue and exhaustion issues, or just an unnamed disease, and I felt lymph node swelling to the physical exam. I saw them tired and exhausted all the time and their history, and I just looked at the lab test and see the white blood cells are there, they may have a chronic virus. Now, there are some people, like the key thing with the thing you have to understand with viral testing is it's expensive. Insurance companies don't cover routine screening for viruses unless there's red flags, which is pretty obvious, like very high monocytes or something like that, or really abnormal liver markers on a blood test. But when you start screening for lab tests in a clinical setting, it can be very, very expensive very quickly. And there's some people that you just can't find the lab marker, so sometimes you just try to support their immune system with things like echinacea, astragalus, grapeseed extract, pine bark extract, plenty of sleep, and see if that starts to improve their total white blood cell count and then how they feel. So a lot of times we'll just use their white blood cell count as an indication to see if their immune system is getting healthier.
Okay, perfect. This is a question I messed up from Genevieve. Sorry, Genevieve. Can you talk about the systemic bacterial infections that use the immune system, such as mycoplasma and Bartonella, like Lyme disease co-infections? Are they similar to these chronic viruses, and if you test and treat them in the same way as these latent and chronic viruses?
Yeah, right. So when you look at different bacteria, you look at things like Lyme's disease or mycoplasma, some of these stealth pathogens, the reason they become stealth pathogens is because they outsmart the immune system, just like some of these chronic viruses do. And for example, Borrelia, the spiral sheet from Lyme's disease, it comes into the cell and it shuts down the cell's MCHC protein signaling pathway to let the immune system know that it is infected. So that's why they become chronic. So as far as treatment goes, there is really no breakthrough treatment. Some people get lucky, they start to feel better. Most people have chronic issues forever once they get some of these pathogens that outsmart our immune system. And that is unfortunately just the way it is.
Okay. How do you diagnose reactivated Epstein-Barr virus?
With the Epstein-Barr virus panel, you have when you do a panel, they have markers that will tell you that if they're reactivated, and there's an interpretation guide, and they'll give you like a probability of it being reactivated. But you just basically run the viral pathogen, the viral Epstein-Barr viral panel, and then there'll be a clear interpretation guide for it underneath. There's 4 proteins you check. There's no point to kind of cover all those. It's too technical. I think we're already getting too technical. But when you do an Epstein-Barr active panel, there's an interpretation guide that tells you if they're reactivated.
Okay. What levels of monocytes would you expect with viruses?
Not all viruses will raise monocytes. Only a few viruses raise monocytes. Most common one being Epstein-Barr virus and cytomegalovirus. But if monocytes do go up, you really need to make sure that the person does get screened for Epstein-Barr virus. And if that's negative, then you got to look at cytomegalovirus as another possibility. But not all viruses will raise monocytes. Monocytes are a marker on a typical complete blood count when they look at the immune system.
Okay. Any suggestions for raising white blood cells?
Right. Suggestions for raising white blood cells would be basically general immune fitness and health. So we go over some of the concepts like sleep, rest, exercise, and the immune resilience program at Dr. K News if you want to check that out. And then the supplements I just mentioned earlier, echinacea, astragalus, vitamin C, grapeseed, just the basic stuff to raise your white blood cells. But a lot of times, to get white blood cells really healthy, you just got to get healthier. For some person, it may not even have to do with immune support. Maybe their diabetes is out of control and they can't get healthier. Or another person can't get their immune system healthy no matter how much immune supplements they take because they're a raging hypoglycemic and their blood sugar levels drop all throughout the day and they just can't make that connection. So their immune system is fatigued and weakened because they constantly miss meals and get shaky and lightheaded. So raising white blood cells sometimes requires a whole body approach just to make the person healthier. It's not always just like you got to take this botanical or this nutraceutical. And that's actually more effective way to get someone's immune system healthier is just to treat the whole patient and figure out what areas are dysfunctioning in general.
Okay. How should we test for Hep C or know if it's being overlooked?
The hepatitis C, you can easily screen for it just with the hepatitis C antibody. If you want to be more specific, there's 2 types of PCR testing. One's called quantitative PCR, one's called qualitative. The quantitative PCR gives you a viral load number, which tells you how active the virus is. You can do a less expensive one um, called qualitative, and that's the gold standard. If the PCR qualitative hepatitis C test is positive, then you have Hep C.
Okay. Do you see heavy metal load affecting virus susceptibility?
Do I see heavy metal load impacting heavy metal susceptibility?
Affecting virus susceptibility.
Sure, but here's the problem.
Uh-huh.
Heavy metalers are a group of people that blame everything on heavy metals. And, toxins in general can dysregulate all parts of the body. The problem is when you check the entire population, everyone has some degree of toxic pollutants or compounds in their body. It's very rare you see people that don't have some degree of chemical load. The problem, so just to judge chemical load as being the problem is sometimes can get you off the wrong track. Like, I'll give you the example. You got a raging hypoglycemic that constantly misses meals, gets fatigued, gets shaky, gets lightheaded. When they get their loss of function and can't think, that's when they eat, and that's what they do every single day, and their immune system is shot, and they understand why their white blood cells are so bad and why they can't get rid of their Epstein-Barr. They can go see someone that's a heavy metaler, and then they go, we got high heavy metals, that's probably why. And then they try to do chelation, do other things, and it's just really a total waste of time. They made an improper association with it. So, yes, technically any pollutants or chemicals can disrupt the immune system, but you got to make sure that it's not a distraction either because of those associations.
Okay. Hold on. Sorry. Can glutathione supplementation help with creating, supporting, and a healthy immune system?
Yes. Glutathione supplementation is also something else you can add to your protocol. And the key thing with glutathione is that glutathione helps support the barriers, the gut barrier, the lung barrier, the nasopharynx barrier, the blood-brain barrier. So you're less likely to have pathogens really get into your system in the first place. But glutathione also turns on regulatory T cells and activates B cells. It's a very powerful immune modulator. So glutathione is something I think everyone should consider taking daily if they're into the mindset of taking nutraceuticals preventively. I know in our family we all take glutathione daily, and it's very effective. Now, glutathione is hard to absorb, getting absorption with it. So liposomal glutathione, which is a liquid form, is very effective. Or taking precursors like N-acetylcysteine can raise glutathione levels very effectively as well.
Okay, Carol's asking, can you please briefly explain about cytomegalovirus, please?
Cytomegalovirus is another virus that is an ugly virus. It can cause chronic fatigue issues, it's like Epstein-Barr, and it can be latent, it can be reactivated, and it's actually mostly misdiagnosed. Lots of people that have cytomegalovirus have only an IgG test, which means past exposure, which a large percent of the population do. But if you have cytomegalovirus, it's like a latent virus. It can, when your immune system and health gets weak, it'll get reactivated. And if you can get your immune system healthier and your whole body system healthier, then you can have it go into a dormant state. So that's the key concept with the cytomegalovirus. Cytomegalovirus seems to have some significant attachment to vascular protein target sites. So it's associated with blood vessel inflammation. And it's devastating to the vascular system, as, for example, like hepatitis C binds to hepatocytes proteins, so it's devastating for the liver. So cytomegalovirus can really lead to chronic inflammation, plaquing in the arteries, which is a concern, and can even damage cardiocytes, which can even cause inflammation in the heart, and some significant risk there. So that's the key thing with cytomegalovirus that you should be aware.
Okay. Thank you. You are so helpful. Sorry.
This was a tough topic, by the way.
This is a really tough topic.
Because there's so many variations, variabilities here. But in any case, please also comment on us if you have some good talks. The reason we did this talk was because someone requested. It was frequently requested on our comments. So. Please let us know.
Yeah. Okay. People are asking about vitamin C. And there's debates over which is the best kind, ascorbic acid, that kind of stuff.
Yeah.
So can you get into that briefly?
Yeah, this is the world of nutrition drama. The world of nutrition drama: sorbate versus ascorbic acid versus how much, and calcium carbonate versus calcium bicarbonate, and all that stuff. This is really where you go when you just have free time. It's not that relevant. Sorbate, ascorbic acid are going to be very effective in treating vitamin C. What happens is, that's what I've seen working in the field of nutrition for a long time. You have people that want to be immediate gurus by saying, oh, sorbate is much better than ascorbic acid or calcium carbonate. And they really don't even know what they're talking about. If you really look at the studies that are being done, they're both effective. They both have outcomes. Some of this just becomes like philosophical issues. And I'm sure I'm offending the sorbate guru or the ascorbic acid guru. Oh well. They have effects in either form in the body. Just like calcium bicarbonate is going to get absorbed, just like calcium lactate. The absorption rates may be slightly different, but not enough to cause significant clinical issues. So it doesn't really matter which form. But I'll just leave it there.
Okay.
They're going to have an impact on your immune system either way.
Okay, someone's wanting to do a talk on detoxification when an osteoporosis. You opened that door now.
Okay,
so here we go. This
great.
is great.
Can you help?
Okay, so Sean this is a little bit complex. Dr. K, please help us understand this statement by the Mayo Clinic regarding chronic or reactivated Epstein-Barr virus. It suggests that early antigen early antigen IgG is diagnostic. Okay? Here's the quote. The presence of antibody to the early antigen EA of Epstein-Barr virus indicates that EBV is actively replicating. Generally, this antibody can only be detected during the active EBV infection, such as in patients.
Yes, that's Epstein-Barr virus early antigen marker. It's not the same thing as just Epstein-Barr IgG. Okay. So that is accurate information. The Mayo Clinic is giving accurate information.
Okay, good.
Yeah.
Perfect.
So early antigen markers
Yeah.
are a specific protein. It's not the same thing as Epstein-Barr virus IgG. Early antigen IgG is different. So it can be very diagnostic to know that there is a reoccurring reactivated infection happening.
Okay. Sorry.
Okay, we'll take one last question. We're almost out of time.
Sorry. People are asking for a lot of questions about. Can herpes zoster be completely eliminated?
No. These latent infections cannot be permanently eliminated. They're in your body. If you test for them, they're going to be there. The question is if they are going to get reactivated. And if you ever do a complete herpes screen, there's herpes virus type 1, type 2, type 3, type 6. There's lots of different variations of it. Many people will test positive for them, not even knowing they actually have one of these strains in their body. So it's all about reactivation. So latent viruses, once you get them, they're always in your body. It's just a matter of whether they get reactivated or not. So that's the key thing. I think what happens, and it's really frustrating for a lot of people that are dealing with a chronic disease, is, to be quite honest, they're going to practitioners that don't understand the difference between acute, latent, chronic, and progressive. They don't understand the difference between PCR testing and acute versus chronic antibody testing, and lots of patients that are not feeling well are getting misdiagnosed and improperly treated because of, to be quite honest, clinician incompetence of understanding these profiles. So be aware of that, and make sure you understand these concepts. Anyways, thank you for joining us today, and
sticking with us
today. Today is a bit tough for my organization, but I appreciate you guys all signing in. Thank you.